me about yourself and tell me what brought you here into medicine.
My name is Dutang. I prefer to go by Vanessa. I was born in Taiwan and I went to Shanghai for my secondary education and then I went to the United States for my tertiary education. I got a bachelor's of human biology and a master's of biology at University of California, San Diego. I started becoming interested in medicine in high school, and recently I have been working in a neurosurgery practice. So I've been really interested in the patients with spinal cord injury. We've been doing a research project about that, and apart from I guess work and being a pre-med, for myself, I have some hobbies I do on my free time when I have some. I play badminton with my friends. Yesterday I went to a badminton tournament, and sometimes I cook a lot, um, and sometimes I come up with new recipes for myself as well.
That's awesome. What do you like to cook?
I usually do Chinese cuisine because that's what I'm used to. So sometimes I think one of my favorites is tomato and egg, just like stir fried because that's the first one I started learning with my mom.
That's great. Awesome. Are you interested in neurosurgery? Are you open to other specialties? What do you think that will look like for you in medical school?
I think I've had some experience in neurosurgery because I've been working in this practice for a while. I've also had some experience in cardiology because I did my master's research in cardiology, but I think that I just have a lot of experience in these specialties doesn't mean that I won't later on come to like other specialties. I think personally, I'm really interested in procedures, and so um, I I would want to do a specialty that involves a lot of like hands-on procedures. But right now I'm keeping my mind open and ready to experience or get more knowledge in other areas too.
Yeah, that's great. So if you could kind of look in the future 10 years from now, what would you hope your career and life would look like?
Um, I think at my with my current mindset, I would like to see myself with, let's see, 10 years. So hopefully somewhere in residency or a fellowship, doing some training, and I know that's going to be very busy, but I hope it's going to be a specialty that I'm really passionate about and I really like. And then I'd go home and probably living alone with a cat and a dog, and then get some rest and have someone to greet me at the door, and then be ready to dive into work the next day.
Fantastic. Awesome. Tell me about a leadership position that you've had that you've been really proud of, and what did it look like for you?
Um, I think a position that I've been really proud of to be in would be one where I was or one of the main organizers of a really big conference at UCSD. It was called Med Conference, and it was a one-day conference with around like um, 30 or 40 workshops for serving like 200 attendees, and maybe another like 200 like speakers or sponsors. And I was with another partner of mine, and it was almost completely student run. We got some help collaborating with other organizations on campus, but we ran like a small team, and we um, I guess we both put in a lot of effort to get down a lot of the details, and I think it was really rewarding for me because I was able to use my power to create something that I felt like was really good, and it was I was able to reach my goal, and I also used this opportunity to provide resources in terms of information and some hands-on workshops for students who are interested in going pre-health or are on the pre-health or pre-med track. As an international student myself, I was also able to use this chance to create a workshop where I invited speakers who can speak on how international students might or what international students will have to keep in mind if they're interested in pursuing a medical career in the United States. And that was really rewarding for me personally, because I didn't have a lot of resources going into this path, and I didn't even know that I couldn't apply to all the schools in the United States until I was almost a junior. And I felt like I'd wasted like the first 2 years of my college career because I had so less resources and so less people to connect to. And I was really glad that I was able to use my leadership position to create a space where people can connect and be no longer be like me back then when there was so much uncertainty um, and they didn't really know anything, but now they can go away with these resources and this information to work with.
That's fantastic. Awesome. And then you had many awesome clinical experiences listed on your resume. Is there one that really stood out to you as most impactful or that has fueled your desire to go into medicine?
One that was, I think, one where I learned a lot from was the one where I volunteered at a hospital. Usually, volunteering at a hospital involves rotating around different departments, and usually, I guess it isn't a lot, but um, it was really rewarding for me because I kind of saw firsthand for myself what a patient mm, receiving treatment really looks like, even though they weren't actively receiving treatment. But during their stay, I saw how a patient was vulnerable, and how had they didn't really have full autonomy over their bodies, and in a way that really struck me really hard, in terms of realizing how important it is for the quality, or how important quality of care is while during a patient's stay in the hospital, and how treatment doesn't only involve helping them physically, but also helping them emotionally and maintaining their care holistically.
Yeah, that's fantastic. Where was that hospital experience?
It was at Mission Hospital in Mission Viejo, around Orange County in California.
Okay, fantastic. All right. And then you had mentioned a master's program and some research in cardiac myocytes. Tell me more about that. What did you guys study? What did you find?
So our team studied a protein called the perm1 protein. It was found to only be expressed in cardiac muscle and skeletal muscle, and a little bit in brown adipose tissue. My project was focused on its expression in cardiac muscle. So in vitro, my PI previously discovered that it could, I guess, help reduce the amount of damage on cardiomyocytes when, well, after like, um, I can't call it ischemia perfusion, but um, when they don't get enough like oxygen. So um, my project was about trying that ex vivo. So we did like an ischemia perfusion experiment on excised rat and mice hearts, and then the hearts had overexpressed perm1 protein in it, and then we could see whether or not there was reduced infarction of the cardiac muscles compared to the hearts without overexpression of perm1. So the finding was that there was, and my personal project was to see whether or not overexpression of the perm1 protein was correlated with overexpression of other proteins involved in the metabolic pathway or involved in apoptosis pathway. And I didn't find any significant findings, but um, I think this just points us in the direction of um, looking in other areas. So I ran Western blots, so I was looking at protein expression, but we didn't look at mRNA expression yet, or even some other proteins that may be involved. So I think even though I didn't find any significant findings, it still pushed our research forward in other areas.
Definitely. What would you think would be a next step, kind of taking what you had learned from that and extrapolating it for a future project?
Um, oh, it's been a while since my master's project,
Yeah.
but I think that um, looking at mRNA expression would be one of them.
Hmm.
Um, to see like if or there are also other proteins in the pathway at the moment I can't recall
Yeah.
that can be explored in terms of their expression. And I think we can also explore a little bit further down the line whether or not knocking out the perm1 protein will cause an effect on the expression of these um, metabolic proteins that I did my research on. There is a possibility that the overexpression of the perm1 protein's goal is to just maintain the vitality of these proteins or like maintain the function of these proteins. But we wouldn't know until we do more research.
Fantastic. Okay, let's pivot a little bit. How do you practice self-care and wellness? Obviously, the road to medicine is very long, especially in medical school and residency, and so it takes a lot of resilience, people kind of stepping up to take care of themselves. So what do you do now? What kind of practices do you hope to continue in medical school?
Um, De-stressing. I think in um my current lifestyle, which is where like I'm working and then I kind of come home, I have my like regular like 8 to 5. I think I've found a pretty good balance where after work um I've I've found a way to like socialize, hang out with my friends. I play sports. I work out sometimes. Um, and then I have some time for myself where I like watch some shows and things like that. I personally, energize by staying with myself, and so or with people I'm comfortable with. So it really helps me, I guess, recharge when I'm just laying on my bed, and I can listen to some videos or like some podcasts and then maybe take a nap or so sometimes. I think when I'm really stressed, cleaning or cooking is a way that really helps me. I love cooking and it just lets me take my mind off of whatever is stressing me out. And I'm doing stuff with my hands, so I'm focusing on that instead of whatever is going on in my mind. Cleaning is also really great. I'm there's no failure component to cleaning because I'm just like wiping down my table or like cleaning the windowsill or things like that. And then it's also a full-on process where I have to clean every like little bit and while listening to like music that I like. And so it's really relaxing for me.
Okay, fantastic. All right. And then tell me, what are two of your biggest strengths that you perceive coming into the medical field? What do you think will make you a good physician?
Mm. I think two of my biggest strengths would be that will help me become a good physician would be listening and patience. Um, while I'm working as a while I'm scribing, while I'm working in the neurosurgery practice, um, I realize that a lot of patients tend to talk a lot about their life, and sometimes it's information that's not related to their condition at the moment that we're seeing them for. But I think that they really appreciate it when someone can really sit down and be patient with them instead of try to I guess, interrupt them. And as a scribe, I do have to ask them questions, but I tend to really kind of wait until they're done with their like current thought, and then I'll move on to I pivot back to something they said previously, but I didn't quite catch that was important, or I would take that as an opportunity to transition into another question that I need to learn about regarding their condition. And I think giving them the space to really talk to me when I'm available about like the factors that, or the things that's going on in their life. I think sometimes they just need someone to talk to, so I can give them like the time for that. And and I think sometimes, I guess, my friends have also said I'm a pretty good listener because I like stare at their eyes, or like make really strong eye contact when I'm listening. And I try to do that for my patients as well, to really look at them, um, make sure they know that I am listening to them and they have my full attention. Or even if I'm not able to make that eye contact, I would, whatever they say, I would repeat it back to them when, well, sometimes it's one of the strategies that I use. I'll repeat it back to them, or like ask them follow-up questions to let them know that, like, even though I'm taking notes on the side, my ears are with them. Um, and so I think those are some of the strategies that I use, and I think it makes me a good listener, and patients really like connect with me that way as well. And I think it'll make me a good physician.
Perfect. How about any weaknesses you foresee or any challenges you foresee with going down the road to become a physician?
Mm, I'm not sure if this would be um, directly related to becoming a physician, but I do know that one of my weaknesses is that sometimes I um, shy away from voicing my opinions when I feel like a space hasn't been created for that. Um, Sometimes I know that like maybe I can say something, but or that I have some knowledge, but I tend to miss the timing for it, or like miss the opportunity, and I don't know when to say it. And I think that's one of my weaknesses in general, um, that is a weakness regardless of in a work setting or in a personal setting, and sometimes it frustrates myself. Um, so I do hope that I can continue to work on that by, I guess, being more proactive, and instead of waiting for someone to create space for me to speak up, or for there to be a space for me to speak up, like I can create that space for myself.
Yeah, that's fantastic. So let's transition over to some MMI style questions. I'm going to put this in the chat, and then I'll give you about 2 minutes to read it. And then we'll transition back. So we'll just kind of meet again, let's see, at 41, if that works for you, 41 minutes.
Okay.
Okay, perfect. Okay. All right, and usually in the scenario, they'll just have you jump right into answering the prompt. So I will just turn it right over to you, and then we'll go over follow-up questions once you feel like you've answered it in its entirety.
Okay. So I think as I believe I'll probably be a student, shadowing a physician, it would be difficult for me to point that out to the physician openly in front of the patient. If the physician doesn't notice that the patient is confused. And so since I am shadowing, I think I can use my position to kind of serve as a reminder for the physician. I may ask the physician, oh, if I can ask some questions, and then I would ask some questions that I feel like would be able to kind of break it down for the patient. So that's easier for the patient to understand. And after, or once the visit has concluded, I can ask the physician, or I can individually let the physician know that I think the patient might be a little bit confused, and then see what course of action the physician might want to take. If they want to, I guess, have their medical assistant or have their staff talk with the patient again, or have themselves talk with the patient again, or bring the patient back in for a couple more minutes to talk. Or if I can ask the physician whether or not I can have that opportunity to speak with the patient, and maybe I can, with another staff member, with a medical assistant who is more knowledgeable, or with a maybe a physician extender who is more knowledgeable. Oh, sorry, more knowledgeable. I can speak with the patient and kind of explain my understanding and see or kind of serve like as a bridge in this bridge to communication in this relationship.
Yeah, fantastic. How would you balance being respectful towards that physician, but also advocating for the patient at the same time?
Um, I think it is a little bit difficult. Um, if the patient doesn't, well, sorry, if the physician doesn't take notice of what I've taken notice, um, I think that I think the course of action that I would take would be to speak with the or give the physician a reminder individually or separately, instead of right in front of the patient, and let the once I guess once the physician has probably realized, then I can the physician um, can I guess speak to the patient in more layperson language, and that is less confusing for the patient. Um, I don't think that it would be appropriate for me to like in I guess mm, immediately or like very strongly take the patient advocate side, um, just because I don't want the physician to feel disrespected, or I don't want to jeopardize this therapeutic relationship and make the patient feel that this physician isn't mindful of their confusion. But I guess I feel like my role is to be supportive of this relationship and to help them like maintain it, and that's how I can be that patient advocate.
Yeah. How do you adapt your communication style for different audiences?
Um, I guess. Mm, I think in terms of different audiences, my experience is that there are patients who have had a lot of doctor's visits and are more understanding of their condition, and they probably or they worked as a nurse previously, as well. When there are patients who doesn't know that much, and they may even have some language barriers. I think for those patients who are more knowledgeable, I would respect that, and I would mm, um, kind of communicate in a way where like, oh, this is the way that we do things. I know you might have experienced some things differently, and this is the information that I currently have for you. But I also put myself in a humble position, where like I would let them know that I am not the most knowledgeable in here, and there are going to be questions that I can't answer for them, that I don't know the answer to, and it will be better if they talk with our physician extender instead, or directly with the physician, or I can help them relay that message and I'll get back to them on that. With patients who are less knowledgeable or may have a language barrier, usually I would break my explanation or answer into different parts, or sometimes I may be staying with the patient longer than the physician is, and I will help explain or repeat what the physician has said once again into smaller chunks, that may be easier for the patient or their family to understand. Or I'll put something in writing, or I'll explain it in a different way that I think may help them absorb it better.
Fantastic. What do you think is the responsibility of medical providers to provide translators for patients?
Um, like whether or not they're responsible.
Yes. Do you feel like that's something that's a provider's responsibility?
I do think so. Um, in my personal experience, our office has um, Spanish interpreters for Spanish speaking patients. who don't understand English. And I think it is, I think it is a physician responsibility. I think it's better to have a, I guess, insurance provided or a physician office provided translator instead of family translate, because sometimes the family members may have their own interpretation of what the provider is saying, and they may translate it as such, or they may turn it into a discussion rather than a direct translation. But we want the patient to, I guess, firsthand hear or understand what their doctor is trying to tell them. And so it's better to have a professional or insurance provided or physician provided translator who can, I guess, word for word, tell the patient what the provider is trying to tell them instead of an interpretation of what the provider is trying to tell them. I guess the other part of why I think that it is a physician responsibility is also because it is also I also think it's a physician's responsibility to make sure that the patients are informed about their plan of care, and maintain this therapeutic relationship so that the patient can will be compliant, or like and will be more, I guess, more literate of their own condition and the treatment that we are recommending.
All right, we are going to slide to the next question. So I'm going to bring that prompt over for you. Let's see. All right. And we will reconvene at 51. Whenever you're ready.
Okay. So I think first of all, I would want to speak with the patient to understand their goals or their reasons for not wanting life-prolonging treatment, and also talk with the family to see why they are insisting on life-prolonging treatment. There is a possibility that this patient with terminal illness doesn't want to continue like suffering on a treatment and just wants comfort care instead, and but the family wants life-prolonging treatment because they want to wait for another family member to come back and to be able to see the patient one last time. But we don't know. So I would want to like talk to them and understand their views and their goals separately for their separate opinions. And then I think I would want to facilitate discussion between the patient and the family so a consensus is reached. And in order to do that, I don't think this is only about me unilaterally trying to, I guess, like facilitate this conversation, but also incorporating other members of the patient's healthcare team to join in on this conversation. So that they are involved in the patient's, I guess, plan of care. I will also want to, I guess, have someone from the hospice care team or the palliative care team to come in and join in that, and they will have the knowledge or the expertise to inform the patient's family about the indications of hospice care and what it involves. Inform the patient as well so that the patient understands what decision that they're making, and if and what hospice care really means if they still insist on refusing life-prolonging treatment and go into hospice care. And then and ideally a consensus will be reached with this discussion, but if not, this patient is mentally competent, and the patient's I guess the patient's wishes are and the patient's autonomy are my first priority, or to respect.
Yeah, fantastic. You already hit on what the next question was, of which was the most salient medical ethics that is most important in this scenario. But can you, including autonomy, which you already talked about, kind of bring up what the other tenets of medical ethics are? There are 4 in total, and then kind of how they relate to this scenario.
So The other medical tenets or the medical ethics tenets are beneficence, non-maleficence, and justice. For I guess beneficence and non-maleficence, I think in this case, for me, in my opinion, kind of goes hand in hand. We're doing what is best for the patient. If continuous treatment will only prolong this patient's suffering, and then and it would actually be, I guess, medically futile for this particular patient in this particular with this particular condition, then I don't think that would be, or continuing or recommending that treatment will be doing good for this patient. In a way, it may cause, if it causes the patient more suffering, then it would even be doing it, it would be doing bad for the patient, and if that is the case, that it may just it'd be better for the patient to have palliative care or comfort care instead. In terms of justice, um, um,
I'm not sure if you're talking. I just can't hear
oh
audio.
yeah, I'm
Just
taking a
thinking.
minute.
No problem.
Yeah.
No problem.
I guess for justice, I would kind of address it as the patient and both the patient, I guess both the patient and the family has an equal right to have their own opinion and to, I guess, participate in making and participate in the medical decision making process for this patient's care.
What role do you think religion has in end-of-life care?
So, I personally have or have done some training in hospice and have worked with or briefly or can work with a hospice patient and still ongoing. And in my training, what I've learned is that religion can be a very important part for patients who are religious. Um, it serves as, I guess, like a spiritual, emotional support for the patient that they kind of rely on towards their end of life. And so um, I think that it's important to like respect that for the patient and really also respect their opinions and like their and the views that they hold regarding their religious beliefs.
Okay, perfect. All right, going to the next question, and we will reconvene at 59:30. Let's get this to send. There we go. All right, whenever you're ready.
I think that this might not be a time when like I had very like big failure, but I definitely made a mistake that could have had a large impact. When I was working as a medical assistant, or I guess less of a medical assistant, but more like as a surgery scheduler for the neurosurgery practice that I work in, or work at. There was a time when for a patient who was moving forward with a really large surgery, I there was a lab that I forgot to order that was about I guess getting the patient's blood type, which was really important for them to for I guess the hospital staff and for the operating team to know so that they can prepare I guess blood in the case that a blood transfusion might be needed because of the extensiveness of the surgery. And I guess in a way it was a mistake, but also I guess it was a mistake that I didn't know I would make because I did not have this knowledge due to some I guess lacking in my training. And so um it could have had a really large impact where the surgery could have been completely canceled in a different and the treatment could have been delayed because of that if they didn't have the materials that they needed. So I guess in that moment in time, I couldn't directly make amends, but it was something that I noted down and put reminders for myself in, I guess, my notes, or like for patients who I know are going to get really big surgeries in our list. And I made sure, to like double check. I made sure that I ordered that for the patients, for these patients moving forward, and also right before their surgery, double check that these orders have been put in, and that the patients would have their blood type screened, so that this, I guess, something like this wouldn't ever happen again.
Okay. Let's say you were mentoring somebody who was in your shoes and made the same mistake. What would you say to them in terms of giving them critical feedback, and then also to make sure the same mistake wasn't made again?
Mm. If I were mentoring someone in my shoes, who made the same mistake, well, I guess first of all, I would hope that I catch this mistake before it creates a large impact. So like while I'm double checking their work before the surgery, so that there's still time to make amends and put in that order, so that like surgery could still continue, or it wouldn't endanger the patient's treatment. And I would let them know that they, I guess I would reiterate that this is really important and why it's important. While I have been training, I guess, other staff in my current position, I recognize that there are a lot of information to retain. So a lot of the times, rather than really like calling them out for a mistake that they've made, I've tried to kind of just reiterate what I've said, and explain the reasoning behind why something is needed or why something is important, and that I believe that helps them remember it better. And if they are, if they're still having trouble with it, sometimes I would give them, I would, I guess, remind them in a suggestive way that like they can take their own notes, and or that they can, or point them to where they can reference my notes if it's in like a public space, or like a public like sheet or like document that can be referenced, that like, oh, it's like it's written here, and for the future, just make sure to like look at everything.
Perfect. Do you believe failure is necessary for growth in medicine? Why or why not?
I do believe that failure is important for growth in medicine, and I think important for growth, I guess, in general too. I think that when someone keeps doing something right or doesn't fail, I think it's difficult for them to see the other perspective, and sometimes failure is important for learning about like the background context for why something is important, or why something needs to be done, or what is right, or how to do something right, and what makes something um I guess something wrong, or the wrong way to do things. Um and in general, I think that failure, I guess, is important for success, and people don't really learn how, or how to, well, if someone is always has their hand held as they move forward, um it's difficult for them to really see, or like really learn. It's difficult to like retain something, but when they make their own mistakes, that's when they make that information for the, I guess, their own, and they really like learn from themselves.
Yeah. Okay, perfect. And then let's move on. This may be our last one depending on time, or we'll do one more after. Let me count this for you. All right, and we will reconvene at 1:07. All right, whenever you're ready.
So I think upon receiving the like a lot of critical feedback on something that I worked very hard on, I think emotionally, my first reaction will definitely to be very upset about it, um, because I probably like thought that I did very well. I put in like a lot of effort into it, and it may feel like all of that was disregarded because of the feedback that I received. But personally, I would take some time for myself to absorb those emotions and kind of come to terms with it, and maybe like let the assignment sit for a little bit and then go back and read it maybe like a day or two later to really read into what the feedback is saying about my work without those emotions. Um, I think that would be able to help me really like really see what's wrong with it, or whether or not that feedback is or what that feedback is trying to tell me. And then I would want to talk with, I guess my professor or my teacher who's giving me that feedback, and really like look into what made them like, I guess put down the comments that um they put down. And I think like talking it out would give me a better picture of what they're looking for or what they saw was wrong, or um maybe like they were looking for something in a completely different direction, or it also gives me an opportunity to kind of explain my train of thought and then I guess like check that with my professor and my teacher, or maybe like we are on like the same wavelength but I didn't express it or like properly. And I think then it will also point me, I guess in a well give me a better idea of which direction I should work towards and how I should fix it. And maybe that the way that I would fix my assignment would not be exactly how the feedback in writing described initially, but I would be better able to, I guess, complete the assignment in the way that really gets my idea to my teacher or my professor. Um, so I think making that connection or like having that interaction is really important. I guess a specific scenario that I've had um, would be, I guess I have to reference my clinical experience. Again, there was this one time when we, I guess, scheduled surgery and then it had to be rescheduled for, I guess, reasons that were out of my control. But that I thought were out of my control. And, but I guess the neurosurgeon that I was working with actually said that, oh, it was also like partially our fault. And at first I couldn't see it because I was really upset that this procedure, which had been on the schedule for more than a month, had to be scheduled last minute. I was upset because the patient was upset. But I guess after a while and after really like sitting down and talking with our neurosurgeon, I guess when there was some argument, but I think that clash is a way to communicate as well. Um, and I really understood where he was coming from when he said that, like, that it was also partially our fault, and I did see like what I should change moving forward. It was about creating, I guess, creating more time for this procedure to be to start earlier so that it wouldn't have to be scheduled because of like other like schedules or like staffing schedules and things like that. And I did see that that was something that we did not create space for. And so moving forward, I made sure to like block out enough time, or like keep in mind that like there is a chance that the hospital might create time for us to move it earlier, or we should try to do that so that we don't run into the same issue again.
Sure. What strategies do you use to turn negative feedback into positive outcomes?
Mm, I think it depends on the type of negative feedback. Um, if it's critical feedback, then um, I think I would make it reflective. or if it's critical feedback about my work or like about myself, I would turn it into like a reflection for myself and for my work on um I guess trying to see from the other person's perspective what they are seeing, and it could be that they're just not seeing what I'm trying to express, or it is really something that I'm not I'm doing that's making them uncomfortable, and I would try to, I guess, um, I guess kind of come to terms with it in terms of, is this, I would want to think for myself whether or not it is still something that I want to continue doing, or if it's something that I feel like should change. I think feedback is also subjective sometimes, and it can be based on the other person's experience, and does not always mean that I have to completely change myself or my work based on what the other person thinks. Um, and I think that, or if it really is something that I realize that I am lacking, then something that I can work on, or I can even seek advice from the person who's giving me feedback on how they think I should work on this particular issue. And I think regardless of if I feel like I want to continue doing what I'm doing, or if I decided to change for the better, both can be regarded as positive outcomes.
Perfect. Okay. And then last follow-up question, have you ever taken criticism personally? And if so, how did you manage that?
Mm, I think I would say that a lot of I guess quite often I kind of default to taking criticism personally. Um, and it is something that I am still trying to work on. Um, how I usually will handle it is that I would, I guess, I would think about it. I would think about the criticism that I'm receiving. And like I previously mentioned, I will talk with the person who is providing the criticism. And then, um, or I will also kind of um, talk with some of my close friends about it who really like know me, and like may also know the person who's giving that criticism, and then bring them into the picture to help me see, or like see a perspective that I am not seeing because of my tendency to take criticism personally. um and I think I think being able to I guess kind of talk with the other person and also talk with someone else um mm, can also help me, I guess, like gradually understand, or like gradually get rid of that tendency to, I guess, like I guess take criticism personally. So that's I guess something that I've been doing.